Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is 28th June 2025. This video is on an article published today online. Just accept it in the Journal of the American College of Cardiology. It's an American College of Cardiology expert consensus statement on medical weight management for optimization of cardiovascular health. We explore this guidance on medical weight management for cardiovascular health. Obesity is no longer just a lifestyle issue. It's a hormone-driven, inflammation-fueled, system-wide disease. Let's dissect how cardiologists get treated with the same rigor as hypertension or heart failure. Obesity as a disease. Obesity affects over 1 billion adults worldwide and shortens life expectancy up to 9 years. It's defined as excess adiposity impairing organ function. It's a key driver of HFpEF, atherosclerotic cardiovascular disease, atrial fibrillation, and sudden cardiac death. BMI is a starting point, but waist circumference, fat distribution, and racial thresholds, example BMI equal to or greater than 23 kilo per square meter for South Asians, better predict cardiometabolic risk. NuSH therapies explained. NuSH are short for nutrient-stimulated hormone therapies like liraglutide, semaglutide, and Tirzepatide are changing the landscape. They act on GLP-1 and GIP receptors, reducing hunger, promoting satiety, and improving insulin sensitivity. These agents produce 8 to 21% weight loss, improve type 2 diabetes, fatty liver disease, steatotic liver disease, HFpEF, and reduce major cardiovascular events even in non-diabetics. It's evidence-based. In the LEADER study, liraglutide was associated with a 13% decrease in major cardiovascular events in type 2 diabetes with high cardiovascular disease risk. In the SUSTAIN 6 study, semaglutide reduced major cardiovascular events in 26%. In the SELECT study, semaglutide in obesity without diabetes, there was a 20% reduction in major cardiovascular events. In the SUMMIT study, the Tirzepatide showed reduction in cardiovascular mortality and heart failure hospitalizations in patients with HFpEF. So this isn't just about weight loss, it's about cardiovascular prevention. Safety, contraindications include medullary thyroid cancer or MEN2. Common side effects include nausea, vomiting, constipation, mostly mitigated by slow dose titration. Monitor for acute kidney injury, gallbladder disease, and hypoglycemia in those on insulin or sulfonylureas. When does weight loss matter? A 5% loss in weight, there's a decrease in type 2 diabetes mellitus incidence. There's a 10 to 15% double-digit reductions in improved sleep apnea, steatotic liver disease, cardiovascular disease risk. There's a greater than 20% lower mortality. Tirzepatide is currently leading the pack with 21% loss. Clinical integration and stigma. Obesity management must be multidisciplinary. Dietitians, behavioral therapists, pharmacists, and cardiologists should work together. Avoid stigma. Use person-first language. Provide high-capacity scales and validate the patient journey. Frequent follow-ups and shared decision-making lead to better adherence and outcomes. Check progress at 1 to 6 months. If less than 5% weight loss, adjust or switch. Continue long-term to prevent regain of weight. Access and advocacy. Barriers remain high cost, $8,000 to $15,000 a year in the US, insurance denials and supply shortages. Medicare covers for type 2 diabetes and cardiovascular disease, possibly sleep apnea, but not obesity alone. Advocacy for broader coverage is ongoing. There are several compounded versions available in the market. This white paper discourages it due to safety and counterfeit concerns. Take-home messages: treat obesity as a chronic, relapsing, and biologically driven condition. Nutrient-stimulated hormone therapies are as important as statins or SGLT2 inhibitors in cardiovascular care. Don't wait for failure of lifestyle therapy. Start medical therapy early. Personalized care. Stay vigilant for side effects. Fight weight bias. This is precision cardiology in action. Remember, treating obesity isn't just about pounds lost. It's about years gained and hearts saved. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.